glaucoma. Now, if we if we suspect a person to have glaucoma and then record a high eye pressure, then we run a series of tests called visual field test.
Okay.
Visual field test is something like this. Now, I think people who had glaucoma may have noticed that they have a test like this called visual field test. And visual fields actually in a normal person should be without these black dots. These black dots indicate where the dead nerve is and where you can't see. The black areas are indicated by non-seeing areas. So, a person with glaucoma will be having this what is called visual field defects, and the visual field defects can progress. Now, I told you that the earliest stage they can have only a small visual field defect like here and here, but if you don't treat properly, it can progress gradually like that.
And it can expand.
It can expand because the nerves will be dying slowly. So, as a result, your fields are getting constricted slowly, and ultimately your field will become something like that. That means you are seen through a tunnel. What I want to tell you is, now majority of we have at eye hospital or any eye clinic, we have a special clinic called glaucoma clinic. Each eye surgeon has a clinic. And unfortunately to tell you that majority of people who are coming to our clinic will be at least having one eye like this. They are seeing like through a tunnel. So, they don't see the peripheries. So, actually now if a person is driving a vehicle and all, that person is at risk of knocking his vehicle on the sides. It's because he will be knocking the other people also. He is knocking his vehicle as well as knocking the other people as well. So, that is the danger. We want to prevent a person coming into this stage, because majority of people we see are coming at this stage.
So, that is already the damage is done.
Already damage is done then. Now, what we can do is, now if we catch a person with glaucoma, if we catch a person with something like this, they have a small scotoma that actually is a minute one. So, we can give treatment because treatment is available. The treatment is actually the doctor has to decide what kind of treatment you are going to give. That is like we give eye drops, and there are different various modalities of treatment. That is, drops is one. There are different kinds of drops nowadays, and laser treatment is another kind of treatment, and surgery is the last treatment. Actually, we don't recommend surgery at the moment for all the people, because nowadays we have very good eye drops which can be effectively controlling the eye pressure and keeping their vision at the same level.
Okay, doctor. So, we will get more these details later on. We will also take a small break now and we will be back with you soon. Stay with us.
Get ready, be a part of Sri Lanka's biggest ever reality TV show. You don't have to sing a single note, dance one step or twitch an eyelid, but in one moment you can become a billionaire. In one night you'll be a star. This is a reality show that tests the limits of your mind. If you have the right answers, you win $1 million. DFCC Mindstar, are you ready for the $1 million challenge?
On the gate. They're just gone. Give me one with a new straight hair.
Hey, stupid Cupid, stop beating on me.
You know, singing green sounds like tequila. I really know it's settled.
Catch you live in action on Prime TV with a blend of music filled with variety. rock and roll, country and western,
It must be love. It must be love.
you name it, we have it. Music with Bevel.
Good morning and welcome back. So we are speaking to Dr. Irugalbandara, and she is also a consultant eye surgeon to the Lady Ridgeway Hospital and also the president of the College of Eye Surgeons. And to stop from where we started, doctor, we were also speaking about the detection of glaucoma, and before to the question I asked you whether there are other types of glaucoma, I was especially referring to the fact that when you said the main risk age group is above 40, I asked you whether infants can also be affected and people below 40 can be affected. So on that note.
Yeah, actually the people who are over 40 are the people who are at risk. But the thing is now, people who are having, now there are certain people who are at risk. They are the people who are having high blood pressure, people who are having diabetes, and people who are on steroids. I think you may have heard about prednisolone. Prednisolone is a tablet given for various illnesses, like people who are having different illnesses like asthma. Are given long-term prednisolone, and some renal diseases also were given prednisolone. So what will happen is they are at risk, because so we have to check all those people who are at risk to detect whether they are having glaucoma and treat them as well. And now you ask me what are the other types of glaucoma. Now there is a different type of glaucoma called closed angle glaucoma. Actually those type of glaucoma is symptomatic. The difference between open angle and this type of glaucoma is that this is symptomatic. Symptomatic means the patient will come to you, a doctor, or come to the casualty department with a eye pain, and the eye will be red like that. Like the first picture here, the eye will be red. But I think you might notice that even a person who is having conjunctivitis will have the same picture. But the difference is they will have so much of pain, and they will be having headaches, and they will have vomiting, and their cornea, this part, the cornea won't be clear, it will be cloudy. So because of the eye pressure, the fluid is getting collected on the cornea becomes cloudy. Now majority of this type of people are ladies over 40.
Why is that?
It is because there is an anatomical difference in our eyes. Now this part is called the angle. Now this is the cornea, and this is the lens, and this is the pupil, the iris. This is called the angle. This part is narrower in ladies. It's because this anterior chamber is a little bit shallower in females compared to the males. So this is, I told you earlier, now this trabecular meshwork is the one which is draining the fluid out of the eye. So because this is shallower, this pupil can become easily blocking this trabecular meshwork. So that's called narrow angle glaucoma. So what will happen is most of them will have headaches in the evenings.
This is for open angle.
No, this is called closed angle glaucoma.
Right.
Open angle glaucoma I discussed earlier, because the angle is open.
Right.
They are the ones who are really at risk, is because they don't have any symptom.
Right.
Now compared to that,
but here this has symptoms.
This has symptoms like redness, and they will be having vomiting and headache and all that.
Okay, so the dangerous form is the one where you don't have symptoms, because at the end of the day you might be blind without knowing that. But here
there are symptoms. But
right.
the thing is, now if you don't detect this one also, now if you just leave it, now say that when you are having a headache, if you just ignore it, and if you are having a redness, if you think that alright, it is only conjunctivitis, I will wait for another 2 days, that is also at risk. It's because now this here, the pressure can go up to about 60, and all of a sudden the eye pressure goes up, and you can become blind all of a sudden. That is the other danger in glaucoma in here.
So that is if we have